YouTubers, I'm glad you're here. Thank you very much for joining me. Today is January 9th, 2023. Over 7,000 nurses at 2 hospitals there in New York went on strike this morning. Nurses at Mount Sinai Hospital and Montefiore Medical Center cite staff conditions and burnout for the walkout. They want better care for patients. They're evidently being overloaded with patients, twice the amount of patients per nurse than what should be going on. More than 7,000 nurses at 2 major New York hospitals walked off the job Monday morning today, protesting pay and staffing arrangements that they contended have overwhelmed health care professionals during the coronavirus pandemic and beyond. A message from the union encouraging people not to delay medical care because of the strike, and stated again that they are on the strike to improve patient care. Here it says, to all our patients and to all New Yorkers, we want to be absolutely clear. If you are sick, please do not delay getting medical care, regardless of whether we are on strike. In fact, we invite you to come join us on the strike line after you've gotten the care that you needed. We would rather be the ones providing that care, but our bosses have pushed us to be out here instead. We appreciate solidarity from our patients, but going into the hospital to get the care you need is not crossing our strike line. In fact, we invite you to join us on our strike line after you've gotten the care you need. We are out here so we can provide better patient care for you. There was another Twitter post from a nurse. It says this is why they've been offering travel nurses to come to work during the New York strike. Evidently, a travel nurse are highly paid. This one here is $9,800 a week. Traveling nurses often get paid at least double what a regular nurse gets paid in any medical facility. Last-minute talks to avoid a work stoppage at Mount Sinai Hospital in Manhattan and Montefiore Medical Center in the Bronx broke down last night. I guess the union walked out at about 1 a.m. today. And the New York State Nurses Association rejected an earlier proposal by New York Governor Kathy Hochul to take the dispute to binding arbitration. Nursing unions across the country have pushed for staffing improvements since the start of the pandemic, citing burnout they contend with as depleted patient care capacity and placed healthcare professionals in harm's way. More than 400 nurses walked off the job at a Chicago hospital on January 3rd for a 3-day strike after layoffs, exacerbating staffing shortages. Nurses in Oakland and Berkeley, California, held a 5-day strike beginning Christmas Eve. Another 400 healthcare workers, including nurses, nursing assistants, surgical technicians, pharmacists, dietarians, and lab assistants, launched a 5-day strike in Marina del Rey, California on December 12th over similar concerns. This here is an image of strike locations that was posted on Twitter. New York nurses were able to reach agreements with 7 other hospitals around a common bargaining framework. Nurses will get close to a 20% salary increase over 3 years. And hospitals agreed to improving staffing standards. Yeah, talk is cheap. We'll see if that happens. Union officials say the nurses are demanding higher wages, better health care benefits, and a smaller nurse-to-patient ratio. According to an internal memo, Mount Sinai did plan to cut services amid the strike, including transferring newborn babies outside of the Mount Sinai healthcare system to ensure they get the care they so desperately need. 2 of the 3 Mount Sinai hospitals will only perform emergency surgeries, the memo stated, and those facilities will start to transfer and discharge as many patients as appropriate. One of the nurses said, as a labor delivery nurse who helps mothers to bring babies into this world, I find it outrageous that Mount Sinai would compromise the care for our NICU babies in any way. We already have NICU nurses caring for twice as many sick babies as they should be, he said. We already have been sounding the alarm about how that's not safe for our NICU patients, but Mount Sinai has failed to address this crisis. It's unconscionable that Mount Sinai refuses to address unsafe staffing in our NICU and other units of the hospital, but is now striking fears about our NICU babies in contract negotiations. So many hospital workers have been let go because of not getting the you-know-what, and those that remain are just totally overworked. And when you're overworked, accidents happen. Sometimes you just don't make the right judgment call. So what are your thoughts? Please put your comments down below. Thank you very much for watching. Thank you for subscribing. Please share. And I'll talk to you later. God bless you. Bye.